Seattle, Washington is where the Al-Shimri family calls home. About 2 years ago, at age 4, Aiden Al-Shimri started having some stiffness in his joints. It occurred in the morning, but cleared up later in the day.
I would literally carry him to the car, 4 years old, he was pretty heavy, and then carry him to the daycare. But I would call, an hour or two later, and, oh, he's fine.
Aiden's pediatrician recommended a specialist who eventually diagnosed him with juvenile arthritis.
By history from the family and by his physical examination, and then by being sure that his lab test did not indicate any other problem going on, I was able to make the diagnosis of polyarticular childhood arthritis.
Once doctors determine a child has the autoimmune disorder, juvenile idiopathic arthritis, they classify what subtype of arthritis it is in order to develop a treatment plan. Aiden's diagnosis meant several joints in his body were affected. He needed to begin treatment right away. One common denominator in all treatments is to suppress inflammation. The first line of treatment is prescription or over-the-counter NSAIDs, or non-steroidal anti-inflammatory drugs.
When we use them in higher dosages on a chronic dose, regular dosing schedule, so that it builds up a level in the blood. And instead of just being a symptom reliever, it's actually an anti-inflammatory agent that suppresses this chronic inflammation, and by that method relieves the symptoms.
If you have a type of polyarthritis, though, that affects 5 or more joints,
she got it on Friday.
These kids have to be treated more aggressively with medications.
Using all of these in combination works for many children, but we often have to add in newer anti-inflammatory medications that are very effective, called anti-tumor necrosis factor medications.
This class of medications, known as biologic therapies, have properties that target cells involved in the body that are causing the immune system problems, leading to inflammation. But in addition to medications, most patients are advised to adopt an exercise regimen to increase their range of motion and keep the affected joints moving.
So we have physical therapists who work with the children and instruct the parents in doing exercises several times a day that allows the child as much as possible to get the finger or the joint that's involved to the end of its possible range.
Aiden and his family has been seeing so much success with his combination of treatments. This normally shy 6-year-old has been able to learn a few things from his older siblings.
My brothers could teach me how to catch and play football.
In addition to the non-steroidal anti-inflammatory medication that he was on, he also went on other medications on a weekly basis. And that has been very effective for him, and he now has absolutely no arthritis at all and is off actually all of his medications. And I'm just delighted, and I know he's delighted, and his parents are delighted as well.
The best part is running and riding his bicycle, playing all his sports. He's growing up. That's the best part of it.